Nurse Staffing by Amber Beaumont, RN, Shanna Carrillo, RN, Nikki Holliday, RN, and myself, Rachel Lumbert, RN. Defining nurse staffing. The nurse-to-patient ratio is the ratio of nurses on a particular floor, ward, or unit to the number of patients. The greater the anticipated acuity of care, as in the ICU, the lower is the ratio in a high-quality healthcare facility. 1 nurse to 6 patients is the normal ratio in a medical surgical unit, 1 nurse to 2 patients in an ICU. Safe staffing, as defined by a federal regulation, mandates that hospitals must have adequate numbers of licensed registered nurses, licensed practical or vocational nurses, and other personnel to provide nursing care to all patients as needed. What we know and what history shows. Hospitals seek to cut costs by eliminating registered nurse positions. In doing so, nursing care is overloaded, causing a decrease in quality of patient care. This causes nursing retention to decrease, while patient readmission rates increase. ANA, or American Nurses Association, reports that one study showed the likelihood of overall patient mortality, or in-hospital death, and mortality following a complication increases by 7% for each additional patient added to the average registered nurse workload. The ANA informs us that inadequate registered nurse staffing results in poor outcomes. Patients are at risk for longer hospital stays, injuries, medication errors, falls, increased infections, and even death. The ANA established the Registered Nurse Safe Staffing Act in 2015. This act would pertain to facilities abiding by Centers for Medicare and Medicaid Services. A group of nursing professionals are established to determine adequate nurse-to-patient staffing to ensure patient safety, reduce admissions, and improve nursing retention. 7 states utilize this act: Oregon, Texas, Illinois, Connecticut, Ohio, Washington, and Nevada. This act was put into place to protect nurses. The Health and Human Services will impose civil monetary penalties for each known violation, and staffing information is required to be publicly available. Leadership and management aspects. Management styles of health organization play a vital role in promoting workplace empowerment, organizational commitment, and job satisfaction amongst nurses in management positions at hospital settings. Behavioral and organizational research on work and workforce effectiveness, health services research, studies of organizational disasters and their evolution, and studies of high reliability organizations have identified management practices that are consistently associated with successful implementation of change initiatives and achievement of safety in spite of high risk for error. These practices include balancing the tension between production efficiency and reliability or safety, creating and sustaining trust throughout the organization, actively managing the process of change, involving workers in decision-making pertaining to work design and flow, and using knowledge management practices to establish the organization as a learning organization.